Pushback against progressive politics isn't just playing out in schools. In New York, COVID treatment is being allocated, at least partially based on race, specifically monoclonal antibodies and 2 new oral antivirals, which appear to be very effective in preventing hospitalization, are in short supply. And the rules about who gets access first are based on criteria like age and health risk factors, but also on race, where people of color are prioritized. 2 white men are suing New York State's Health Commissioner Mary T. Bassett and New York City's Department of Health and Mental Hygiene for discrimination. With us is Anastasia Boden, senior attorney with the Pacific Legal Foundation and lead counsel in this lawsuit. Anastasia, welcome.
Thanks for having me.
Can you tell us what exactly the rules say that have triggered this lawsuit?
Well, as you may know, we've had this wonderful treatment approved for COVID, but there is a scarcity. And the state of New York and the city of New York, New York City that is, have both instituted rules to essentially triage who gets the treatment and who doesn't. So it's created this hierarchy. And the hierarchy is based off of how many risk factors you have. Several of those risk factors are unobjectionable. They're things like age, cancer, pre-existing conditions, diabetes. But the state and city have also designated race as an independent risk factor, saying that race in and of itself is significant in some way, despite that the Mayo Clinic has said that it's not. There's absolutely no reason that somebody of a given race would have worse outcomes than anybody else. And so that means that race alone for some people is going to give them higher priority. Within certain tiers that the state has established, they're going to be higher in those tiers, or it may even push them into a higher tier. So for some people, they're going to be denied treatment based on their race alone.
Basically, if you have 2 people, same age, same conditions, same vaccination status, all those things, one is black, one is white, then the black patient's going to get the treatment. Is that essentially what you're saying?
That's exactly right. And our clients just want equal access to treatment with everybody else when it comes to race. They don't object to certain medical conditions being considered a risk factor, but they do not think that race should play a role, just as the Mayo Clinic has said that it should not. It does not necessarily play a role.
Have your 2 clients been denied treatment?
Not yet. We are bringing this case for prospective relief because they don't want to wait. I mean, we know that COVID numbers are on the rise. There have been government officials who have said at this point, everybody's going to get COVID, and they don't want to have to wait until they get COVID and are denied in order to go to court. That's just not really a feasible option for them. And so, particularly for one of our clients who was hospitalized with COVID last year, he wants to know that if he does get COVID again, he's going to be able to seek treatment without race playing a factor in whether he is able to access it.
So the justification that they have for this policy is that longstanding systemic health and social inequities have contributed to an increased risk of severe illness and death from COVID-19 in these groups. How do you respond to that?
Yeah, well, one thing is if you think that there are certain correlations between race and other factors that may lead to worse outcomes, let's say that there's overrepresentation of certain races in certain occupations. And so if you're a frontline worker, or if you are more of a you're in more of a public facing occupation, you're more likely to get COVID or a worse, a more virulent form or what have you. If there's anything that is associated with race, use that as the proxy, use that as the risk factor. Don't treat all people of one race as the same and penalize other people of other races by using this really crude proxy for risk. It treats people as if they're all the same just because they belong to the same characteristic, rather than seeing people as individuals with different risk factors who make different choices, different professions, etc. We need to use that as the way that we dole out medications and get race itself out of the use of medicine.
This isn't an isolated case. Last March, the U.S. Department of Agriculture also wanted to make race the basis for giving debt relief to farmers. That went to court. The judge issued an injunction. But how is it's clearly against the Constitution to discriminate based on race. So how is this being justified? Why do they think they can keep trying again?
Well, I think it's part of this consistent push in our society to elevate race above everything else and to see people, again, in this sort of collectivist way that that race is somehow significant and determinative for people, when in reality we should seek a society where race is irrelevant. I mean, it is an arbitrary characteristic. It's something that we're born into, and genetically it means almost nothing. But again, we just see people pushing for this. It's part of this equity movement, I believe, and it's part of thinking that people deserve something based on their race. And Supreme Court precedent has been clear. You can only use race in very narrow circumstances, because even when the government purports to try to help people on the basis of race, it very often can end up harming the groups in terms of stigmatic harm. And it's also burdening people who played no part in the injustice and who really don't deserve to have their own rights trampled upon only because of their own race.
We've got to wrap up, but let me just ask, do you know of any other states or cities that have similar policies at this point?
Well, New York City and New York State were the first, but certainly other places had proposed it. And thankfully, thanks to pushback, and I think because of lawsuits, places like Minnesota and others have walked it back a little bit. But we think that these states have their eyes on New York, and that's why this lawsuit is so important to once again set the clear precedent that this is unconstitutional and denies people equal treatment before the law.
Be sure to watch the entire episode, now available exclusively at EpochTV.com, a new completely censorship-free premium subscription platform brought to you by the Epoch Times. See you there.